Hello, everyone. For this OCD tips video, I thought we would focus on treatments for OCD. There's two main evidence-based treatments for OCD. And when I say evidence-based, what I'm really referring to is that there's a large body of research behind both of these treatment modalities that have been shown to help a lot of people with OCD. The first one is exposure and response prevention. This is often considered the gold standard treatment for OCD, and it's been around since the early 80s, also known as ERP. ERP basically includes slowly and gradually exposing the person to what it is they're fearful of, while withholding their typical responses. So, for example, if a person would typically avoid using public restrooms, an exposure and response prevention technique might look like having them slowly and gradually begin to get closer and closer to using that bathroom until they were willing to go ahead and use it, while preventing their typical responses, such as washing, showering, or just avoiding in general. Exposure and response prevention has been a wonderful treatment. According to the research, it helps about 60 to 70% of people with OCD. However, doing exposures can be really, really challenging, and ERP isn't always helpful for everyone. And so another evidence-based treatment for OCD is known as acceptance and commitment therapy, also known as ACT. ACT has also been around for a very long time, and it is also an exposure-based therapy. So it has a lot of similarities to ERP. However, it does add in some components that ERP does not include. So acceptance and commitment therapy might look like spending additional time exploring what the person's values are, what matters to them in life, and how the OCD may be robbing them of things that are particularly important to them. What we notice is that both ERP and ACT are just as effective. However, from my personal experience of using both, I noticed that by including some of the concepts in ACT, it helps people just be a little bit more motivated to do some of the harder exposures. ACT also includes using some cognitive strategies called cognitive diffusion, which can help people sort of step back from the OCD, have a little bit of distance between them and their thoughts, engaging in the exposures just a tad bit easier. It's all hard. Doing exposures, whether it's ERP or ACT, it is challenging. Having OCD is challenging. And as a therapist, I find it very, very rewarding to use evidence-based strategies such as ERP and ACT, because I do see how much my clients benefit from it, how much they're able to work through the obsessions and urges and spend more of their time doing the things that matter most to them, rather than spending their time focused on the OCD. So I hope this tips video has been informative, and I look forward to sharing more information with you in the future. Thanks for listening.